is Lynette Mara, the Executive Director of the Unconscious Bias Project. Thank you so much for joining us for another Facebook Live. This week and next week, we'll be talking about racism and inequities that are affecting many groups right now during the coronavirus pandemic. And we'll also be talking about ways to support these groups and what you can do to fight bias in the everyday. If you can hear me, I wasn't able to do the test earlier. If you can hear me, please give me a like or a comment. I hope everything goes well. So if you're new to the Unconscious Bias Project, I'll just briefly tell you, we are a nonprofit that creates accessible, evidence-based, creative solutions for unconscious bias and bias in workplaces and classrooms. And normally we do this with in-person workshops. Of course, like many folks out there, we are now working from home. And as I've explained in past lives, we started noticing this just increase in discrimination and xenophobia. And as news is starting to come out more and more, there are some really serious inequities that are getting worsened during this pandemic. And so we put together this our Together Against Bias series to address some of this, to give you practical tools to let you know what's going on, and to give you some ways to support these folks or support yourselves. And we've done this in a few different ways. We're in the works developing podcasts on the topic, also interviewing folks that are either being affected by this discrimination, xenophobia, racism, and inequities, or are within those groups and provide resources to help. Let's see, what else do I want to say? Right, if you're interested in what we do, please check out our website. It's www.unconsciousbiasproject.org. Selena, thank you, Selena, is posting links in the comments for you. And if you want to support what we're doing, we do have a fundraiser attached to this. We are really, really close to reaching our goal. So if you have $10 to spare, we'd really appreciate your help in helping us put out these free online resources for everyone. Okay, I think that's right about it for announcement. Oh yeah, please do stay tuned. I have a update about the party that we're going to hold. So I'll talk about that at the end. Okay, so today I want to tell you a little bit about some of the problems Native Americans, or also known as American Indians, are facing, as well as Black folks and Latinos. And yes, I said Latine because we want to be more inclusive of all the genders and, you know, wherever anybody's at within our community. So first off, I just want to give you a little disclaimer. There is absolutely no way I would be able to cover all the problems we have with discrimination and inequities in this country, let alone in this world, alone in this video or in the next week. I'd have to probably talk for a whole year. So I'm picking very specific things and strategies. So if you have something you want us to cover, maybe a concern or some news piece that you've seen recently, email us, you know, put it in the comments, DM me. You can find me, Lynette Mara, on Facebook, on Twitter. Yeah, we're happy to consider whatever topic you want to discuss. So one thing that Black, Latina, and Native American folks all have in common is a sad and deep history of either colonialism and slavery, or so either or colonialism or slavery or both, unfortunately. And that has really shaped the way our institutions and our systems affect us. like how disparately, for example, our health and law enforcement systems affect us compared with the majority. So what does this look like during the pandemic? I'll just talk really briefly about these problems. But if you haven't already seen the news, Native Americans are having a really hard time with the coronavirus. You've probably heard of the Navajo Nation, which is huge. It's one of the larger groups in the United States. It includes over 350,000 people, and they've had reports of over 1,300 cases of coronavirus and 49 deaths, which is triple the number of cases in either Montana or Wyoming, which is astounding. And not only that, Native American nations, period, are having a much harder time accessing emergency help they need because they face a lot more red tape than probably any other group we know. On top of all that, we know that staying on top of the number of cases of coronavirus is a really important part in fighting this pandemic, and all that testing is also really important. And what we're showing is that over half the states that are reporting a demographic breakdown of COVID-19 cases have completely erased Native Americans by lumping them in an other category. And so this means that when Native Americans aren't included as a separate category, you're essentially removing them out of existence. There's an article that I think I sent Selena to post. If not, I'll post in the comments later, that interviews, I think it's Abigail Eco Hawk, and she says that without data, Native Americans don't exist, paraphrasing. And if they don't exist, then they don't exist for allocation of resources, meaning, it's gonna be so much harder for them to ask to get resources, ask for the government to intervene, which is completely absurd because Native Americans have some of the highest incidences of COVID-19 risk factors like diabetes, which is really serious. Another thing that complicates everything is the fewer health resources. So emergency units located at reservations, hospitals and clinics that are able to put folks on ventilators. There's actually not that many that can do it, and definitely not very many in areas like reservations or near reservations. So that's pretty bad. So what can we do about it? Well, I'll actually get to what can we do. So I'm just reading my notes. I have so much to cover today. I'm actually going to cover a little more on what we can do later. But in general, advocate, right? So if you live in cities or states with a large proportion of Native Americans, such as New York City, Oklahoma, California, make sure, contact your representative, tell them to keep track and publish numbers, tell them to track, specific nations that are represented. If you didn't know, there are at least 574 federally recognized nations, and they often have very specific treaties with state and federal governments. So that can also really affect specific tribes, and it can impact their access to resources. And donate. Selena's going to post some links for groups that are helping Native American tribes. And and of course, I'll talk a little bit more at the end of talking about Black and Latina folk, but there's those negative stereotypes are everywhere, and unfortunately, negative stereotypes are sort of the after effect, if you will, or the continuing effect that we have from these deeper history of racism, discrimination, slavery, colonialism. So it's very important to tackle them at the personal, interpersonal level, as well as these sort of broader, health systems or national levels. Okay. So switching topics, Black folks. Yes, I'm not Black and I'm not Native American. I am Latina. But Black folks, if you haven't read the news, seriously, I understand if you're under a rock because the news has been pretty bad. Black folks are screwed if they wear a mask and doubly if they don't. If you don't know the extent of discrimination and inequities Black people face, just Google "while Black." There's literally barely anything that a Black person hasn't been harassed for or arrested for doing. Anywhere from shopping to eating a sandwich. And I'm literally not kidding on this. Um, so what does this mean, in terms of the pandemic? So um, Black folks have been reported handcuffed for wearing masks because they look suspicious. They're not suspicious, okay? They're just like you and me. We need masks to protect ourselves as much as possible and to protect each other from spread of the virus. So for that specific thing, so wearing a mask, or if you see somebody at a store and they're Black and they're wearing a mask and they're starting to get harassed, intervene. I covered how to intervene in moments of bias for Asians and Asian Americans. It's the same thing here. Just say, hey, aren't they just wearing a mask like I am? You can intervene like that. You can check in with a person. Every single time that you see an act of aggression, either if it's overt or if it's much more slight, if you will, or appears slight to you, intervene, say something, do something, check in with that person afterwards. All of those things are important. In the health space, if you just Google Black and healthcare system, and you'll see that there's an unfortunate history medically of misinformation and purposeful mistreatment of Black people at the hands of medical and scientific professionals, unfortunately. If you haven't heard about this, just search Tuskegee experiments. This is pretty deep and pretty broad. So so that's as far as some of the reasons why Black folks might not search for help in the health system, or why they might mistrust some information that's out there. We have some really big problems there that we still have not done a great job addressing. That history, plus the negative stereotypes associated with Black folks, have led to, even before the coronavirus, disparate health outcomes for Black people, and especially Black women. There's been several studies out recently examining health outcomes for Black women that are giving birth, and they're much poorer than their white counterparts, which is really sad. And so what does this translate to in terms of people that are contracting coronavirus? Again, we know that essential workers, doctors, nurses, they're all doing every single thing they can for every single patient they can. Unfortunately, stereotypes, unconscious bias, overt bias, it's everywhere, and it's really, really hard to escape it. So, medical professionals, whether they intend to or not, will internally assign a higher pain tolerance for people of color than white folks, meaning that if somebody is a person of color and they say, I am in pain, like I have a splitting headache, give me pain medication, they'll say, no, just wait it out. Whereas if the same age, same gender, same everything person who's white and came and said the same thing, I have a splitting headache, I need some pain medication, a medical provider is more likely to give them that prescription. Right. So what do you do? So if you're a healthcare provider, um, try to be aware of this. Try to speak up. If your clinic, if your hospitals, if your ER doesn't have policies or education around discrimination and how to treat patients of color, ask them for it. There's lots of resources out there. There's several groups that specifically target discrimination in healthcare systems, and that can be really helpful. It's just a Google away. Um, on the other side, there's been, so in places, for example, like Chicago, that has a large Black population, even though they have a large Black population, more Black people are coming in with coronavirus, and there are disproportionate to everyone else. There's a lot of speculation or reporting, if you will, around why that is. Some people say lack of information, lack of leadership, lack of outreach. They are just not listening. They're just not educated, and I want to stop that right there. you know, the wrong thing to do is to assign blame to the folks that are coming in with these symptoms because they didn't cover their face, because they weren't able to stay home. It is not their fault. We currently have a lot of confusing information out there about the coronavirus. There's not a lot of centralized leadership on, what to do. We need more outreach into these communities, and this can be done by folks that are already active in those communities, community leaders, religious organizations that have a good reach in the community. They're the ones that we need the most right now to be doing this educational outreach, to really be talking to people about what to do, because it's really hard to know what's going on, unfortunately. It's a very quickly changing problem, this pandemic. Okay, briefly, what you can do to help Black folks out. There's a list. Thank you, Selena. There's a list from NAACP on coronavirus resources. Give it a look. There's places you can donate. If you can't donate, ask if you can volunteer. Again, advocate for policies that center people of color. Advocate for policies that center sort of inclusion when it comes to resources and help, and specifically for Native Americans, Black folk, and Latine. We're seeing disparate educational outcomes. So everybody's online right now. Kids are trying to take online classes. And they're not maybe doing as well as their majority counterparts. Really quickly, Selena has an article, or sorry, a YouTube resource for educators. If you have a diverse student population, please check out Cora Learning, I think it is Cora Learning. They have really great resources about how to reach out to your students, how to be proactive, and how to really think about the resources, educational resources that you're putting out there, and health resources that your university or school are putting out there to make sure that they're inclusive. What else did I want to say? Okay, so switching topics to Latinx. Hola, hola, Latinx, ¿cómo están? Unfortunately, the coronavirus pandemic has hit Latinx pretty bad. One of the articles that I recently read about why this could be is that people of color, and especially Latinos, make up a lot of the essential workforce that we have. You can think of our farm laborers, people doing cleaning, people running the transit system, for example. People, sending our mail out. A lot of these folks can't stay home. And sometimes resources, educational resources aren't being put out there with the right cultural context, with the right wording. Again, as I said earlier, the information about this virus, information about the pandemic, even information about how it's spreading or what to do or what the symptoms are, it still keeps evolving. So it's really hard to keep on top of everything while you also have, either a lack of care or a mistrust of the healthcare system. If you are not Latine and you don't know that many Latinas in your groups, we come in all shapes, sizes, and colors. You can be from Colombia and be Black, and you can be from Colombia and look like me, really pale. I promise I'm the palest one in my family. So, Latinas can face multiple different stereotypes. They can, they're affected by the coronavirus, and they're affected by discrimination in all sorts of different ways. And specifically for Latinas, it's really important that we understand that Latinas and other people of color often live in multi-generational households, and may live with more than one family group in the same space. So this can be one of the reasons why, on top of being essential workers, one of the reasons why they're being disparately affected by the pandemic. And the same sort of negative stereotypes around people with heavy accents, for example, comes into play in healthcare situations, in emergency situations like these. And when people are just under high stress, and there's a lot of uncertainty, these are the ripe situations for unconscious biases to bubble up, for people to sort of either knowingly or unknowingly fall into scapegoating people, or just really seeing somebody that looks different to them as an other. And so again, take those steps now. It's never too late to start recognizing and targeting your own unconscious bias. It's never ever too late to speak up if you see something happen. Again, for healthcare providers, I know you're doing absolutely everything you can. Ask your clinic, your hospitals, your ER groups to help support you. I'm not asking you to do a ton more work, but just have your hospital to help support you and the resources that you need. So it's not like an extra step that you have to do in order to take care of a person of color. Those resources are just there for you. You don't even have to think about it. It's just right there at your fingertips. Right, there's another group that I wanted to talk about. So Latinas, undocumented immigrants. Right now, we're really seeing that folks that have been say taken up by ICE are having a higher incidence of coronavirus infections. It's really sad for lots of different reasons outside of this pandemic. Important things that you can do are support groups that are advocating for release of undocumented immigrants from ICE. Support legislation, vote for policies, vote for officials that center and take care of these populations. And I'm talking about undocumented immigrants, Latinos, Black folk, any person of color, American Indians, all those people. Like, you really have to look at it as a whole package when you're voting, when you're advocating. Another thing you can do is to so if you can't vote for whatever reason, if you do have a little bit of cash, consider supporting organizations that are helping each one of these groups. Selena has put links for a couple resources to support each of these groups in the comments. I do want to give a shout out to, let me double check. Ooh. I believe they're called the Chicano Federation. The Chicano Federation has been doing a lot of work in California to help undocumented immigrants, as well as Latina and Hispanic populations in California. So please consider supporting them with your dollars. If you can't support them that way, consider volunteering. They're always in need of translators. They're always, you never know how you can help until you reach out, right? That's the best thing to do. What else did I want to say? Oh, right, of course. If you know of any Native American, people of color owned or Latina owned businesses that you love, give them a shout out in the comments. We'd love to support them too. That is also a great way to help these folks, because we are all being hit really hard in this economy. And you can think of, your favorite burrito spot, your favorite earrings made by a Native American. Like, those folks are being hit the hardest right now. So consider supporting those businesses with your dollars. Again, reach out to them, business owners, see how you can help. Another thing I wanted to say is, and this is really important, is I wanted to address the proverbial elephant in the room. It's really something that we haven't talked about just yet, and I want to mention today. I know we're going a little longer than the 20 minutes, but bear with me. And that's in-group bias. So what does that mean? That means that if you belong to a certain group, you can still have bias against your own group. So you could be a woman and also be misogynist. You can be Latina and also have bias against people who are like you. And this is across the spectrum. There is not a single group that I've talked about that doesn't or can't experience this. The other thing I wanted to talk about is colorism. So within groups of people of color, and yes, Asians and Asian Americans can be people of color too, there is something called colorism, meaning that there's a preference given to those on the lighter skin tone of the spectrum than the darker skin tone. It's a really, again, it comes back to that history that I talked about in the beginning, and is something to be aware of. If you are in one of these groups, question, who are the leaders that we're electing? Who are the people that we're putting in positions of leadership? If I have a council on diversity, and everyone on that council is all light-skinned, question that, right? Bring it up, talk about it. This is something that we need to, the more we talk about, the more we bring it out in the open, the more easier it is to address. And lastly, I also wanted to touch on another problem, which is discrimination against any of these groups by other groups, meaning there is a history of discrimination, for example, in Latin American countries against Black people. There is a history of discrimination, and it's something current. For example, in China, against people with dark skin, especially um, Africans. And so it's I didn't want to get too complicated, but it's sort of, that's the way it is, you know. And right now, as I mentioned, people are under stress. There's a lot of uncertainty. It's the time that people seek to scapegoat a group that is the other. And we're seeing this for Jewish folk. We're seeing this for Black folk, for Latinx, for Chinese and Asians. It is going to happen, and it'll happen internationally. It'll happen at home. It'll happen, you know, in your neighborhood, and we need to look out for that, and we need to do things for that. And what can you do, right? So, as I've said before, first steps, you can recognize your own bias and take steps to address that. There's information about that on our website, and I've talked about it in the previous videos. Second step, speak up. Say something, act, do something. Whether it's publicly reaching out to the person that's being affected, that's being targeted, whether it's speaking up against aggressors, whether it's checking in with the person that's being targeted after the fact. Another really important thing is reporting incidences of discrimination. There is a link for reporting discrimination. That's they're trying to collect worldwide discrimination incidences, and advocate for policies that are inclusive. Advocate for you know, for protections of these people that are being affected. You know, you could be joining us from, you know, locally in California, or you could be joining us across the world. We've had people on YouTube that are, you know, commenting to us from Europe. You know, you can always find groups that advocate to help these people. You can always find politicians that are centering these problems. There's legislation you can always advocate for. Just whatever you do, don't sit still, right? Act. Okay. I know, that was hard. All right, deep breath. All right. What else do I want to say? I wanted to say, you know, if you are running an organization, you know, make a statement, right? We talked about that when we talked about discrimination against Asians and Asian Americans. If you are in China and you have a business, or you know somebody there that has a business, ask them to put out a statement. You know, we don't condone discrimination of Black people. That's it. It can be that simple. You know, just words can be really helpful. If it's online, be sure to intervene. Just, you know, don't sit still. Okay. We want, you know, we're going to be wrapping up our Together Against Bias series in the coming weeks. And so if you want me to touch on a subject that I haven't talked about, if there's an article that came up that's really burning for you and you want us to cover it, send it to us. DM me, DM Unconscious Bias Project, send us an email. We're open to talk about it. Even if you see something and want us to address it after we close the Together Against Bias series, you know, we will, you know, look for ways to address it. I mentioned in the beginning, podcasts. We're putting together podcasts where we're interviewing folks in all of these different groups and hoping to talk about the problems caused by coronavirus, as well as resources and what to do. So, you know, we'll keep you up to date on that. The other thing I want to talk about is, oh, yes, we've received an amazing amount of support. We feel so lucky, so happy that we are able to bring these resources out to the public, that we do have a little bandwidth to talk about these problems and try to amplify folks that are being affected, trying to amplify folks that have resources to help. And so we're celebrating. We're going to have a big party May 23rd, 3 to 5 p.m. It's going to be really exciting. It's a huge dance party. Even if you don't have the space or the bandwidth to donate, if you don't have the time to spend calling your elected officials to make sure they're doing everything they can against discrimination, you can still come to the party. You can still come together with us to celebrate all the folks that really make this possible. For myself, that's Chris, my partner, Emily, Fox, and Steve, who are helping out with taking care of Remy. My parents, all of these folks are important for us to be able to put these resources together. We've had developed amazing partnerships. We are developing amazing partnerships, which we'll have more posts on that soon. We've had folks donate really big donations, really small donations. Everything has really helped us. Your words of encouragement. I've gotten a couple, emails and text messages like, thank you for what you do. I'm really jazzed about your videos. I really like your resources. And all of that is helping us put together these resources to fight bias and discrimination during this pandemic. And like I mentioned in earlier videos, the things that we're experiencing now, they're not just going to evaporate once, they figure out a vaccine or something. They don't just disappear. They sort of stay with us and they keep on affecting us afterwards. So it's important to continue using the tools and continue doing the things that we're talking about. Back to the party. We're super, super excited to have Ome DJ be our DJ and entertainment for this party. If you haven't checked her out, oh my gosh, it's amazing. It is, she just has so much energy. Her music is really good and she does everything. Like she literally spans so many genres and does them really well and is super engaging. If you haven't checked her out, check her on her Facebook. She does Facebook Lives and Instagram Lives periodically. She's done so since the start of the pandemic. She's had at least I forget if it's 15 or 20,000 viewers over the course of this pandemic, which is astonishing. She's going to be really great. We have really fun things in store for the party. It'll also be a fundraiser, but you should not feel pressured to donate if you don't have the funds. Tickets are a sliding scale, so essentially pay what you can. And invite everybody. Invite everyone that that wants to party. It's kid friendly, so I know you can't just okay, I'm just gonna leave the kids at home and go party on Facebook Live. You can't do that. You're all stuck at home. So it'll be really fun. It's space themed. It's called Shelter in Space. Shout out to Kat Adams for working together with me on the title. So if you want to dress up. If you want to dress your kids in a space outfit, that's really awesome. Work together, make it an activity, right? We all need something to do if we're not, super tight in the work that we're doing or, doing essential work. Okay, that was pretty long. Thank you so much for sticking through to the end of this video. I'll see you next week at the same time. We're going to talk some more about inequities and discrimination that people are facing during this pandemic. Again, if you have a topic, an article, something that you want me to talk about, I will definitely consider it. And have a wonderful weekend. Bye.